Hello and welcome to Open Science and COVID-19 webinar. My name is Sally and I'm your host today. Joining me live from Geneva is Robert Terry from the World Health Organization, and live from Scotland we have Graham Steele from the Open Knowledge Foundation to discuss open science and open access in times of and post global health emergencies. This discussion is a part of the pandemic response by My Science Work, an initiative to discuss and disseminate ideas and findings that shed light on the COVID-19 pandemic. First, a few comments. My Science Work serves the global scientific community with a twofold approach to accelerating research, optimize funding, and avoid duplication of research. So on one hand, My Science Work advocates and practices open science and unrestricted diffusion of knowledge since its inception in 2010. The My Science Work comprehensive database hosts more than 90 million scientific publications and 12 million patents accessed by a community of professional scientists and science enthusiasts from around the world who use the My Science Works open network to deposit and discover scientific publications of all disciplines. Simultaneously, on the other hand, My Science Work provides a suite of advanced data-driven solutions for research institutions to map, to manage, and to accelerate internal research. Now, I'm barely scratching the surface here, but I will attempt to introduce our panelists for those of you joining in. Robert Terry is one of the lead authors of the 2013 WHO World Health Report Research for Universal Health Coverage. He is a leading advocate for open access for medical research and has authored a number of articles around the topic. Currently, he works for the World Health Organization's Special Program for Research and Training in Tropical Diseases, TDR, where he is responsible for knowledge management and ensuring evidence is translated into policy and practice. Joining us live today is also Graham Steele. Graham is an open science ambassador for Open Foundation International Scotland and has been actively involved in patient advocacy work since 2001. He is also involved in advocating for open science, open access data, and acts in an advisory capacity for the Public Library of Science. And as of December 2013, he acts as a coordinator for the Open Knowledge Foundation Open Science Group in Scotland. Now, before we dig in, I would like to take a moment to remind our attendees joining us live here and on our YouTube channel to direct any questions you may have for our panelists in the Q&A section or the comment section. And we will try to address as many as we can along the way or towards the end of the discussion. So with that, I think we will start. Robert Terry and Graham Steele, thank you very much for being here. It's a great honor to have you both on the very first of our pandemic response webinar series. Before we jump into the discussion, I think our audience will really appreciate to discover a little bit more about the interesting work that you do. So perhaps we could start with you, Robert. Could you tell us a little bit more about your work with the World Health Organization and your role as the head of knowledge management?
Okay, so I'm just going to share some slides, just it's easier for me to discuss with those. So I work for TDR, so you can see these slides? Just
yep.
Let me know. Okay, great. So TDR, it's an organization that's been around for more than 40 years. It was established in the 1970s, and it's actually quite interesting in terms of where we are today. It was established as a partnership within the UN between WHO, UNICEF, UNDP, and the World Bank to address those diseases where normal commercial research were unable to produce new drugs and new treatments. Fast forwarding, we've funded over 10,000 projects over the time. We trained possibly more than 10,000 researchers. And interestingly, we just did a survey of those researchers. Our focus is on low and middle income countries. And we found that more than 70% of the people that are still active that we've trained through one of our programs are now involved in the COVID-19 response. So we're very pleased to see that these efforts at building capacity and research capacity are actually working. And then, as I said, we've done a lot of work on developing new drugs for tropical diseases in our past. And today we're much more involved in how you implement research and using research for implementation impact. What I do is is work in what we call knowledge management. So I'm just going to show this slide here. And I think it's useful for this type of discussion. What are we talking about when we talk about open access, and where does it really impact research? And so this is a very simple schematic about the research cycle. And I think there are three real areas where this works. One is on the input side. So how do we decide what we work on? How do we shape the research agenda? And that needs us to be very good at mapping research, understanding who's funding what, where, and how, and using all the available information that we have to set proper priorities. And priorities always means choosing what to do and what not to do, because resources are always limited. So it's extremely important. The outputs, which I guess is one of the main focus today, is around publishing. And I think we're going to be focusing more on how do we access, read, and reuse the research that's published today. And one of the key elements in any research publication is the data that underlines it. We do need to get much, much better at sharing the data and using the data. And why do we need to do that? Well, it's all about impact. And the key thing is using all of this work to inform policy. And I think right now in COVID-19, it's been quite refreshing actually to hear a number of politicians saying, we're going to follow the science, we're going to follow the evidence. And I think that's exactly right. And so what I do is a lot of work on the methodology. How do you understand if a piece of research is good quality? And how do you synthesize that evidence so it can be used by others, sometimes policymakers who are not necessarily scientifically trained, to inform their policies. So that's what I do. I'll stop there.
Well, thank you very much, Robert, for the introduction and the insights into TGR. Before we dig deeper into the subject matter, I would like for our audience to get better acquainted with you, Graham. Your journey of getting involved with open access has been a rather personal one. Would you be willing to share this information with us and perhaps give some insights into your current involvement with the open science movement?
Sure. I shall do my best to speak slowly. If I do speak too fast, please tell me. Sure. Just over 20 years ago, I lost my brother to a rare, fatal neurodegenerative disease called a variant CGD, or Creutzfeldt-Jakob disease, also known as mad cow disease, here in the UK. And 2 years after that, I became involved in patient advocacy. It must be a time working with charities across the world, helping to spread information, be of use to families and patients, etc. Up until 2006, I just took it for granted that every single scientific paper was behind a paywall. Looking through PubMed, I just came across paywall. I then happened upon a paper in the Public Library of Science, PLOS Pathogens, that was open access. That was the first time I'd ever seen a full scientific paper. I then clicked back a few more screens and found the whole journal was open access. And then I discovered open access itself, reached out to most of the open access and open science advocates throughout the world. So, yeah. One example I would give generally, if somebody reads a newspaper, finds an article about cancer research or whatever, you might actually click and actually read the whole paper. I think, especially when most academic research is funded by taxpayers, I think it's a fundamental right that the public should have access to scientific literature.
Absolutely, I agree. Well, thank you very much for that introduction. I believe I speak on behalf of all our attendees when I say that we are thankful for the work that you both do and extremely honored to have you both here today. Circling back to you, Robert, WHO has been a leading advocate for open access and medical research, as have you. You have authored a number of articles on the topic, one of which being the creation of a global observatory for health R&D. What are some major benefits associated with this? I mean, both open access and the creation of a global observatory.
So what I did was the idea came out of some work we were doing, creating a research strategy for the World Health Organization. And what became clear is it's very hard to know quickly who is funding what research in what country, what research they're doing, and how that research is then being used. And one of the ideas was if we could collect that information together and try to create a single observatory, we would be in a much better place to understand where are the gaps, where are the strengths. And when we need that information quickly, like right now, we have somewhere where we can get that information at the touch of a button. That sounds really simple, and unfortunately, nothing is as simple as that, because there are lots of difficulties, and the main ones are just standards. It's how do you compare apples and bananas and oranges when everybody's using slightly different approaches. And so that's one of the bigger challenges, always one of the bigger challenges actually in open access, is to make sure that we're able to be interoperable, that different things that are published in different places can be used. I'm going to show another slide, and this one is, it looks slightly scary, and I guess it is in a way, because what this is around is open science. It's more than just access to literature. It's really, how do we democratize science? How do we get everybody that has a stake in science to be involved? And when we talk about open access, I think there are three things, and that's in a little box there on the top left. It's about getting something digital and online, and to be honest, it's the internet that's enabled this, but it needs to be free to access. You need to be able to open your internet, go find something, and it's free to access. The other advantage is it needs to be licensed properly, so it needs to be free to be reused. So somebody can take it, reuse it. You don't need to get copyright in the way, and that allows it's a digital license. But also it's really important as we move from paper, which is a fantastic archive. You know, we can read papyrus from the Egyptians 3,000 years ago and it's fine. Digital material degrades very, very quickly. So we do need to get standards into our digital publication to ensure that something that's published today will be able to be read in 4 or 5 years' time. There are many, many, many other areas that need to happen in order to improve the way that we do science. And some of them are shown in this diagram, some of them around open government data, open education. And if anybody really wants to look, if you look in the bottom left-hand corner, there's an organization there called FOSTA. It was funded by the EU. It provides a tremendous number of free-to-use resources to understand what open science is, how to use open science, and how to be trained in being more open in your research. So I think I'll leave it there.
Perfect. Thank you. So we talk about improved and accelerated research coordination and, you know, matching resources with public health priorities. But coming back to you, Graham, why should scientific and medical research, in your opinion, be an open access resource for the entire world, for the people of the world, that is beyond the research community?
I would, well, I touched upon that earlier, but copyright, as we note today, commenced around about the year 1710, and up until maybe the last 20 or 30 years, up until now, the tradition was for researchers to hand over copyrights to publishers, and it's been, as I say, over the last few decades, the research is now becoming.
Sorry, Graham. Sorry to cut you there. Could I ask you to speak, because I see some of attendees asking you to speak a little bit slower and a bit louder. Could I please ask you to do that? Thank you.
I was expecting that. I shall try to speak it slower and louder. The point I was trying to emphasise was that until comparatively recently, the researchers, when they submit an academic paper to a journal, at the same time you hand over copyrights, so people at large can't access publicly funded research. I think it's just a right thing to do. The best way to do science is to do it openly.
Right.
So I think it's very important, especially in current situations like now. What publishers tend to do, but subscription publishers will maybe push their paywalls aside for a duration. After we're through this situation, it'll be back to normal again. But I think it's just people should have access to, apart from sensitive data and information, one of the main thrusts of Open Knowledge International is that apart from sensitive information, where possible, all data and all knowledge should be available to everybody. It's a fundamental right.
Absolutely, absolutely. Couldn't agree more. We talk about having access, but what about, in your opinion, about the participation element, for example, in citizen science? And also, I would like to touch on Don Sim's CJD case, which I know that you are quite familiar with and has a personal relationship with. Apart from access, that personal involvement, what can you tell us about having that kind of right to be involved in science projects and clinical trials?
I'll touch briefly on the case you mentioned of a family called the Sims family in Belfast, and their son Jonathan, like my brother, who contracted the variant CJD. In that particular case, that's led to experimental drug treatments involving a drug called pentosan polysulfate, which had to be injected into the brain because drugs like that they don't pass the blood-brain barrier. So it was a crucial stage of my life, and for that family and for other families that were going down this route. And it was life-saving information was needed. So getting access to all the relevant scientific articles was a very pivotal role for patients. That's just one particular case, but that could equally apply to the public at large when they're in a time of need, needing access to information without having to pay for it.
Right, right. The benefits are indisputable. Yet recent public health emergencies, particularly where data needs to be shared rapidly, revealed that the structure for sharing research data is, for some reason, is neither being used nor sufficient for the purpose. Robert, what are some underlying causes for this dysfunctional system?
Yeah, it's true. There's quite a number of, barriers, we can call them that, to sharing data. I'm just going to put a little picture up just to help us walk through them. So they come in lots of different ways, and it's often easy just to immediately criticize the researchers, but in actual fact, there's a whole environment around why data is quite difficult to share. The first one is a sort of a large political question, which is who owns data? And that sounds like a simple question, but it's actually, the answers are not that easy. There are economic barriers. It costs quite a lot of time and money to share data, to clean it up, to make sure that it's interoperable, that you can actually make some useful and sensible comparisons between the data. And so what we often find on the researcher side is they say, well, what is the incentive to share these data? What are they going to be used for? How will they be used? And this is a particular issue for a lot of the researchers that we work with in TDR who are based in a low resource setting. They may well be the place where the data is found, and this is certainly the case for, say, Ebola. But if those data are then exported and analyzed by researchers outside of the country without any interest in capacity building, then in a sense, you've got a very unequal situation. And then there are technical challenges. It's skilled work creating data sharing platforms. You do need standards again. And there are some ethical issues which need to be resolved. So under a research protocol, people give their consent. They want their data to be used for an analysis. But normally it's a very prescribed analysis within that research protocol. So we do need situations where we can work out how those data can have secondary uses. And also we need to think about the data that's being collected right now in clinical care for COVID, how that can be used for research as well. And later I'll talk about some of the potential solutions to those issues.
Sounds good, thank you, thank you. So Graham, I would like to ask from you, in your line of experience as a patient advocate in the past, what can you tell us about those who actually make use of open access material? So patients and people who are genuinely looking to be partners with the physicians in making better healthcare decisions. What could you tell us from your line of experience?
That's similar to what some people call cyberchondriacs, people that walk into their GPs or doctors' surgeries with armfuls of information. I discussed this briefly with my late GP, but personally he was of the view that, yeah, doctors and the patients can work hand in hand with regards to information, with regards to the internet generally, and for medical research, etc. There's lots of good information, there's lots of bad information, there's lots of misinformation. But one argument used by some traditional publishers about 10, 15 years ago, the publisher Biomed Central published sort of 10 myths about open access, and some of the publishers were putting out misinformation that it would be dangerous for people to have access to full scientific articles. But so that's the argument on one hand, but on the other hand, you can read a lot of bad information and you can make bad decisions. But you can get almost anything published in a peer-reviewed journal, but it's generally accepted that it's more sensible to rely on published research rather than just I found it on the internet. So I think it's wrong to say that it would be dangerous for people to have access to good, sustainable, peer-reviewed articles, whereas on the other hand, anybody can read anything.
Yeah. Can I just, Sally, just come in on that point? So it's quite interesting. It's just one of the interesting things, if you actually look at the history of public libraries, we've been here before. So if I speak to, say, my own background in the UK, it wasn't until the 1850s we had a new law which allowed public libraries to be established. And interestingly, when that law was being debated, many of the politicians at the time were saying this is a dangerous thing. If we allow the ordinary man access to a library, then they will have access to information, and this will cause all kinds of disruption in society and all of those types of things. So it's not a new situation, and perhaps we're now getting to the stage where the internet is the global public library, and so we do need that access. There are a couple of examples I can think of where patient engagement has had a real benefit. One of them in the UK, a charity that worked in dementia. It only had scientists and experts on its panels for deciding who was funded from this charity. And then they changed, when the CEO changed, to somebody who wasn't a scientist. And they brought people who, not with dementia, but people who were caring for people with dementia onto some of their selection panels. And what they noticed was the research agenda changed. And it changed from technical interventions and finding a cure to also including mental health research to how to support carers of people with dementia. So the scope of the charity was changed to meet the needs of those living with the disease as well as those looking to maybe find a cure in the future. So I think that's one thing, is patient involvement can often change the research agenda. And then in America, there's an extremely powerful group looking at juvenile diabetes. The Juvenile Diabetes Research Foundation was established not by researchers, but by parents of children with that condition. And I would say today it's one of the most effective advocates for research. It is a very powerful lobbying group, and it's funded a huge amount of research in that particular area. And again, driven by patients, people with a very strong need in that area to have better access to information and to use it to inform their actions.
What's the group called?
The Juvenile Diabetes Research Foundation. Thank you, Robert, for that addition. It's encouraging to see that there are these kind of movements with time, trying to bring into light the importance of open access to the public at large. But if I may, clearly there seems to be this lag from the mid-2000s to where we are today in terms of open access. Robert, I think you would be the best person to answer this question. What is holding research world, notably the academic sphere, back? Because in an opinion article published on PubMed Central, you mentioned that there are multiple things, but also the role of funders of research needs to change as a part of the solution. Perhaps you could share some more specifications regarding to this?
Yeah, okay. I mean, I think in response to this discussion, I would say there are two parts. One is access to the articles, the published written material, and then there's access to the data. So if I speak about articles first, I would say research funders generally have now all coalesced around the idea that making their work publicly available, mostly to the people who have funded that research in the first place, through taxpayers' money, is a good thing and needs to be supported. And we've seen lots of initiatives, lots of research agencies now have a policy of open access. TDR had a policy since 2012, WHO since 2014. And more recently, there's been an initiative out of the European Union and coordinated by Wellcome Trust and others to say, okay, now no more. We need to absolutely get to the end game. And this is a group called the Coalition S, which is the Coalition of Open Access Research Funders. And they're really saying by 2020, absolutely everything we publish, everything we fund and is published will be open access. What are the real barriers? Well, it's an extremely profitable industry that we've been up against. I mean, I started working in this area in 2001. What you have to remember, or what you have to be aware of, is that it wasn't always like this. So it was only really in the 1960s, we had people like Robert Maxwell in the UK with Pergamon Press, who went around all the learned societies and showed them that by charging for their publications, as opposed to including them as part of their membership, they could make money. And if we fast forward, Elsevier and others, Elsevier recently, and over the last 10 years or so, is making profit of in excess of 35 to nearly 40% on its turnover. That's more than Google makes, that's more than Amazon makes. So it's a hugely, hugely profitable industry. So getting that to move and shift is a massive challenge, but we are getting there. The other bigger problem is actually the way that research culture has moved. And so what we've had from the 1950s and 60s, there was the invention of a measure called the impact factor, which essentially is if your paper is published in a certain journal, in a certain place, then it has a number, and the higher the number, the better that particular publication is. And it's been extremely difficult to wean researchers off that particular measure. And it's also very simple for research funders to use it. So we have to change those cultures, but we are getting there. And I think the newer generation, the younger researchers that are coming through, those that have kind of grown up with the internet, I guess, they seem to be getting it. So I have some hope. If you like, I can speak to data as well, because it's a slightly different and more challenging, but I don't want to take all the time.
Please, by all means, please share your material.
Okay, so let me just, again, I've got a little slide just to help me remind myself of the things. So I spoke earlier about the various barriers to sharing, particularly data. And here is a slide which is some of the solutions. And I would say the key message here is you need a holistic approach. You can't just change one thing and assume that will change research data sharing. And I think research funders, and I'm as guilty, I think I wrote one of the first data sharing policies when I was at Wellcome Trust back in 2005. But unless you back it up with something, nothing seems to move or happen. So I'm very pleased to say with TDR, we have a number of partners. And one of the key ones we've had in more recent years is with this group called the Infectious Disease Data Observatory. And we've done a lot of work with malaria, with schistosomiasis, and with bilharzia disease and Ebola data. And so there are some solutions here. The first thing is that any data that's being shared needs to follow these things called the FAIR principles, which is basically you have to be able to find the data. I know it's out there. You have to be able to access it, so free. It has to be able to be interoperable, so you can compare what were initially apples and bananas. You can actually start to compare them by bringing them together in a standard. And you don't need to be restricted by unnecessary licensing arrangements, so you need to reuse. I think what's more important is, particularly if you're working with researchers, say for Ebola, so in Sierra Leone or Guinea and Liberia, that sharing needs to be equitable. It can't disadvantage the researchers who are based in those countries. So collect the data in one place, export it, and it's analyzed in Northern Europe and America to no benefit to the community that's there. So how do you solve that problem? Well, we've done some work, particularly, so there is something now that has gone live called the Ebola Data Platform. And the key things, so again, I don't want to take too much of the time, is firstly, you need to have a clear research agenda with those data that are being shared. And then everybody is clear, okay, I see why they're sharing the data. There is a real public benefit here. There is new information we can get. So if I bring that back to, say, COVID right now, one of the worrying things that we are seeing is that the BAME community may be more susceptible than others, but we don't really know. And in any of the clinical trials that go on, or even in the case studies that are being collected, there may not be a sufficient number of cases for us to draw any significant conclusions. But if you share those data, and certainly globally we will have lots of data, we may be able to understand in more detail why it is that certain people with certain heritage are more susceptible than others. I think in terms of other things to do with data, I'll just very quickly do this. You need, because often this is patient data, you can't just put it on the web. There needs to be standards, there needs to be security, there needs to be encryption, and you need to manage the access to that data so that it's used by bona fide researchers for proper purposes. And all of that is a skilled process. It actually requires money to train people to be data managers and those types of things. And then the last point, which is something more for us, everybody has a stake in this, is who owns data? Who owns patient data? Is it the patient? Is it the doctors? Is it the hospital? Is it the government? And I think we need to move away perhaps from that argument about individual ownership towards something like stewardship. So if the data is well cared for, if it's being used ethically and for good public health benefit, then we don't have to answer the legal question of ownership. We have to say, okay, we are protecting the use. And I think those are the key things that we need to put in place. And we are beginning to put in place, like I said, for the Ebola data that we've collected, to show a new way of doing this type of work.
Thank you, Robert. Thank you very much. So one of our attendees, Sarah, she has a question for you with regards to practicing open science and open access within WHO, and also specifically related to clinical trials and findings. What are some best practices that's implemented within the WHO and TDR to ensure that we do not come across these barriers, or rather to overcome these barriers?
Yeah, and it's a great question. I think the first thing is that WHO certainly today doesn't run clinical trials, but we do have a lot of engagement in the coordination of activity, and obviously we have a very strong interest in the best research being done. So we've made a statement, in fact the statement came out during the Ebola crisis, about the first thing that needs to happen is that all clinical trials need to be registered. And this comes right back to a point I made in the very early stages, which is put the summary data of the clinical trial into a publicly accessible database. And WHO actually runs one of these. It's called the International Clinical Trials Registry Platform. And that's the first thing, so that we know what trials are being done, where they're being done, what is the protocol, what is being tested, and what is the population that's being tested. And in actual fact, even just with, there's only about 20 data points that are used in the International Clinical Trial Platform. You can do a tremendous amount of work in terms of identifying where there is lots of activity, which population groups are being studied, and those types of things. WHO strongly encourages people to share their data and their research data, and that's what we would say the work that TDR has done with different groups in TB and malaria and schistosomiasis and Ebola is showing that there are platforms in some areas which have all of the requisite pieces. They have proper governance, they have managed access, they have a research agenda which is meeting the public health benefit. And I think if we can put those things in place, then I think we'll be in a much better space going forward.
Thank you, Robert. So going forward, that brings us to a very interesting question, and Graham, I would like to ask this from you. Do you see academic publishing changing with what we are experiencing right now?
No.
Will it be any different to the Ebola and the Zika epidemics, in your opinion?
I think Robert made some excellent points on this topic earlier, but as I spoke earlier myself, during situations like this, with the current COVID-19 situation and Ebola and other pandemics, etc., publishers will get the point and they shall become more open during these times, but once the situation is passed, it will just be normal service resumed. But yeah, academic publishing is not so much a monopoly as an oligopoly. There's only 2 or 3 players in charge, and I think the rough ballpark figure scientific publishing is $10 billion a year industry. So change is happening, but it takes the research funders, the World Health Organization, Wellcome Trusts, the Bill Gates Foundation, etc., to actually mandate change. So change will come, but the publishers won't like it, but we'll get there eventually, but it will take time.
I sure hope so. And Robert, just before we hop into the Q&A, I would like us to, from all that is going right now, I mean, there's a solidarity trial that's happening right now with WHO. Internally, is there not hope, but are there measures that's being taken actively to reshape knowledge management and distribution?
Yeah, I share Graham's frustration. I mean, I think I wrote an open access policy for Wellcome Trust back in 2003, and here we are in 2020. But things are changing, and I think it's been one of the big focuses recently has been this new coalition to really change from a kind of mixed model we've had for many years, where we've had some subscription, people have been paying to have their research published, and then it's free to reuse. A lot of the big research funders, so Wellcome Trust and Gates, the European Union and others, are now saying no more. We're not going to have this anymore. We are going to change so that everything that we fund is going to be, if it's published, it's going to be available for free online and able to be used certainly for, say, the European people, the people that funded it. And I think we are beginning to see that change. It's been way too slow, but it is happening. We've seen everything under the Nature Group is now going to be open access. Elsevier have made a commitment in that space. Where this is still creating some issues is what type of model do you introduce to make things sustainable? So a lot of the publishers are saying, well, we need to ensure that the prices you pay to publish maintain their current profit ratios, which I don't really understand how that really holds up. And in actual fact, if we look in other parts of the world, if you look in, say, Southern America, they've never had anything other than access to their literature. The majority of their journals are published through learned societies. They're funded by public sources. And so in actual fact, their situation is we don't want to be in this introduction of the author pays, because now we're seeing a slight change in some journals, say in Brazil, who are going, oh, we didn't know we could create money out of this. So there's a slight problem there. But we are changing. Is there something which allows us to feel more optimistic? Well, again, if you just allow me to share some slides, and here is a graph. This was very kindly supplied to me by the director of Europe PubMed Central, and this shows what is being published in what are called preprints. Now, preprints are not peer-reviewed articles; they are complete articles. So they describe the the purpose, they describe the methods, they describe the results and the outcome. They shouldn't be used for clinical guidance, but they are able to rapidly share information. And I think if we look at this particular slide, you can see, certainly within the medical sciences, 2012, 13, 14, very, very low numbers of people publishing in that way. And then since, I suspect, Ebola and then Zika and now COVID, although we need to really work on that to work out exactly, we've seen this massive increase. It's not a huge thing compared to actual peer-reviewed published papers. We've seen a massive increase in the number of preprints that are appearing in these places. However, and more significantly, let's look at the next slide. This, so this is just to give you an indication from something that's relatively new. It was launched in June of last year, and this is specifically for clinical research. So this is organized by the BMJ, Cold Spring Harbor, and Yale. And again, you can see a modest increase in the number of preprints that are appearing. So from very low hundreds up to 750 or so in March of this year. So that's interesting. That's a change because traditionally, certainly medical researchers were very, very reluctant to share their data early in that way. So finally, and this, I would say, this is the one that really gives me hope. This next slide is usage. And usage has grown massively. So in September of last year, hundreds of, maybe 60,000 people were looking at these preprints and downloading them. And this is provided to me by Theodora Bloom, the executive editor of BMJ. As of currently, she reckons there are between 3 and 4 million views and downloads of these preprints happening right now. So that is a massive, that's a massive change. You see, it suggests the demand, which is good, and it suggests there is usage through downloads. Of course, we can't tell if these are automatic downloads or robots or all of those types of things, but it's beginning to give me the sense that there will be a change in the way that research is published and used as we come out of this pandemic.
I agree, Robert. So there is a demand, there is a usage, it's clearly evident, but as one of our attendees, Annette, has already asked us, so what is holding back researchers from, making their research open access? Is it is the problem internally, or how can stakeholders, mainly the funders of research, how can they initiate a change by implementing some academic incentives for rapid dissemination, or where is the disconnection between the collection of data and making it quickly available?
Yeah, did you want Graham to answer that first?
Actually, I'm blown away by those last 2 slides about the preprints, and I haven't seen Theo Bloom for a couple of years, but I will take screenshots of those. My understanding is, with regards to researchers and information about making research openly available, there's not much training that academics and researchers.
Yeah, exactly.
I've had my paper published in Nature. That's fantastic. Impact factor. Has anybody read it? Oh, I don't know. It's lack of information. So I also act as a publishing consultant. That's one of my companies, GPS Consulting, to work with libraries, universities, individuals, just to share information about not just being the tenure ladder, but actually the whole point and the usefulness of actually making research open. So broadly speaking, my understanding is it's a lack of training and lack of knowledge with academics.
Yeah, I agree with Graham. There is an absence of training. As I mentioned earlier in these slides, the Foster group do provide a tremendous number of resources online, free training on how to do your science in a more open way. It's not just open access publishing, it's open science books, it's open data, it's a whole range of different activities. But it's true, scientists haven't been brought up with this as being one of their key goals. The biggest problem is the way that we evaluate science mostly, and certainly in the last, since the 1960s and onwards, it's been very much predicated by this single measure, this impact factor, is what I call a toxic measure, because all it really counts is at the time of publication, you were in a certain journal and therefore you're given a particular merit. There's no re-evaluation of the impact of that paper 5, 10 or 15 years down the line. And of course, the problem with that system is it's a double-edged sword. You know, one of the papers that were published in one of the most famous journals, you know, The Lancet, which was fraudulently claiming that the triple MR vaccine was having a particular problem, that would have never received the amount of attention it received if it didn't appear in The Lancet. And so there's a real double-edged sword to this kind of these hyper journals with lots of communication all around them and those types of things. The shift is happening, and it needs to happen in a number of ways. The first thing is we need to move away from measuring the impact of where something is published to the impact of what it actually changed and whether it was used. Is it used in a guideline? Is it quoted in a guideline? Is it actually used by patient groups like Graham will be working with? Is it quoted or been used on social media? And there are other ways of doing that. And there is a group, there is something called the Declaration of Research Assessment, DORA. TDR is a signatory to that, which basically says we will not use the impact factor in any of our assessments when we're funding science going forward. Other researchers have signed up to that, Wellcome Trust, Gates and others. And in a sense, we need to just get rid of that. It maybe worked at a certain point of time, but it's an outdated measure. And we need to be far more looking at was the research accessed and read and by who? And did they use it? Does it appear either in some guidance or guidelines or those types of things? And I think if we can kind of move towards that type of environment, then we can be a lot better off. So if you may, the frustration for me when I was sort of first advocating open access wasn't so much about let's all read stuff for free. I mean, that's good and all that. What I really wanted to do was to move towards a new way of doing science. Because one of the areas that when I was at Wellcome, we did a lot of work in genomics. And what we really need is if you have a proper digital publication, you can make linkages between the gene sequence, between the text, between the data, between other things, and you can actually discover new knowledge across languages, across different research groups. But in order for that to happen, you've got to have the data open, it's got to be in a good digital standard, and we can actually move science forward faster because it'll be able to be read with more accuracy by machines. And this is where we're starting. This is where we'll start to get real advances. The internet so far has been really hampered by, unfortunately, this kind of cultural, almost Luddite way of doing publication. And if we can move forward and move in more accurately into the digital world, I think we can really see some exciting things.
Thank you, Robert. Thank you very much for that. It's greatly insightful. Graham, would you agree on some of the points that Robert shared earlier when he said that the groups, the interest they show that is beyond just accessing journals and publications, but what, in your line of work, how would you say the groups interact with open access and open science?
Just passing thoughts and just come back to what we're saying, that this partially in response to that, text and data mining is a huge entity. I was involved in a small software company called a content Rust, but I think the machine there's huge potential for what you can do with openly available information using text and data mining. So if Robert wants to maybe talk a bit more about that.
Yeah, well, I've got just a final slide. It doesn't really, it just gives a little bit more around that. And I think we just need to publish in different ways. So I would much prefer that we publish first and then we measure the impact later rather than just on the day of publication. And there are other ways of doing it. So there are new platforms out there where you actually, we are highly reliant on this thing called peer review. And peer review normally is only the opinions of 2 other researchers, generally speaking. So it's not exactly infallible. New ways of publishing, publish first, and you publish with the peer review comments. They're also online. You know who the peer reviewers are, and it's an iterative process. You actually grow the quality of the evidence that's being presented in a way that can then be seen by everybody and used. And to be honest, this has been the norm in physics for years. I mean, this is how you would normally do things. You would publish first, you would get lots of comments, you would maybe brush up the paper, and maybe even 5-10 years later, you publish it finally in a journal. Clearly, in some areas of medicine, we need to be clear, what are we using the evidence for, and if we're making clinical decisions, then we need to have an endpoint that we say, okay, we will take something. But it's never, ever based on one paper, or it shouldn't be. It's normally the synthesis of a body of work, and then you actually have to do a sifting in the quality, and then some estimates of whether the quality of the evidence is strong or weak, or those types of things. But if we can get onto these platforms now, where it's open access, there may well need to be a fee to do the editing and the setup, but it's more open, and certainly the peer review is more open. Then once we have a better digital version, then we start to moving into the new areas of science. So text mining and the semantic web and all of these things we've heard about for many, many years needs millions and millions and millions and millions of data points to make them accurate. But if you can start creating those situations where you can do word association within sentences, so that something is a positive association as opposed to a negative association, i.e. this paper is not about malaria, it's not a malaria paper, for example. But more importantly, you can start bringing in the data, the chemical compounds, the gene sequence, other things, and you can start to create and bring together new knowledge you couldn't do previously. And that hopefully will make science again more accessible to everybody, and like I say,
sure.
Science.
Definitely. So I think we are 51 minutes into the webinar. I think now would be a good time to jump in the Q&A, because we have quite number of questions coming in. I'm going to direct the first one to you, Graham, because I think you also could answer this from patient advocate point of view. Samir is asking if there are risk factors for the public health to speed up and sometimes loosen up peer review, especially for a critical subject like the COVID-19. In your line of work, would you associate this as a risk factor, and how do you see of us overcoming this?
Can you ask me that again?
Sure. So Samir wants to know if there are risks for the public to speeden up and loosen up sometimes, peer-reviewed articles, especially for critical subjects like the COVID-19. How do you, in your line of work as a patient advocate, how do you address these kind of risk factors?
That's a tricky question. I guess that could partially tie in with what information is contained within preprints as opposed to actually peer-reviewed articles. I don't have any immediate response. I know I can see where you're coming from, but that's a tricky one. I don't know what you would think about that, Robert.
I think, yeah, I mean, recently we've had advice from very high places about certain types of treatment which we wouldn't want people to use. So I'm not going to name any names, but you only have to read the label on the bottle to know the clinical advice about drinking disinfectant. So what I'm really trying to say is, single pieces of evidence, no matter whether it's a preprint or a single article, it's extremely rare. There are a few cases, but it's extremely rare that a single piece of evidence would be used to make a change, certainly at a policy level. But having said that, and certainly when I was working in the UK, I think it's actually patronizing to say that patient groups are unable to understand and interpret and work with the data that comes up. I mean, and they have a huge invested interest, and with some reading around and understanding where something is published. So again, understanding the background of a particular journal, looking at the methods that's been used, those types of things. Patient groups, and there are many, many that I know of in the UK, are perfectly capable of understanding and realizing, and it's extremely rare that you get a black and white situation where it goes, do this or don't do that. So I think I don't have a particular fear of increasing access to that. And what I would say, again, if I go back to the example I know about this dementia charity that in the UK that brought on so-called non-experts, I mean members of the public, onto their panels, what they found, one of the interesting findings they found was that other scientists suddenly had to explain what they were doing in plain language. And other scientists went, well, that's interesting. That's the first time I've actually understood what you've been doing for a number of years. Because it's, you know, it's a cultural thing. Nobody wants to admit they don't really understand. And I've always been told that if you can't explain something simply, then you probably don't understand it. And I think we should always bear that in mind.
Absolutely. All very true. Anit has a question for you. Again, Robert, she wants to know what is done exactly to avoid profit companies using open access data to develop products that are then unaffordable for those from whom the data came from.
Yeah. I don't think there's anything that can be done, actually, interestingly. I mean, one of the interesting things about putting things out in an open way is that you don't restrict the reuse. There are some tweaks, there are some changes you can make to the open access licenses. The most commonly used one is Creative Commons, where you can actually restrict reuse to non-commercial reuse if that is what you want to do. And that's what WHO does with its material. So it says, you know, anyone can use this for educational purposes, for research, for any of these things. But if you want to use it for a commercial purpose, you actually have to sort of, like classic copyright, come back to us and seek permission. So if you want to put that sort of caveat on your work, you can do it. And you use what's called the NCCC BY license, so the non-commercial Creative Commons attribution license, and that would put in that particular safety stopgap if that is a concern.
Right, okay. Because we are quite ahead of the schedule, I would hop into maybe two more questions. So what about the Sci-Hub initiative? Do you think that such initiative should be supported growing to a global fight for open access?
No, I wouldn't. You're talking about the Sci-Hub, the pirates website.
Right.
I still find that whole topic quite fascinating. I wouldn't recommend people using that. It's not that there are legal other options you can do. What was I thinking of? I've got the browsers installed, but see, things like Unpaywall, etc. Places where you can legally go looking for articles that are behind paywalls. But I personally find it quite fascinating that after all these years, Sci-Hub just can't be closed down. But if I can't get a research paper, what I did historically, I would just write to the author. I found I did that about 1,500 times and about 90% compliant. Because if you're an academic and you published a paper or somebody says, excuse me, can I actually read your paper? I'd be thrilled to give it away, even though you shouldn't. Yeah. I would recommend the defaults. Totally far from it.
Yeah, I agree with Graham. I think it depends on your context and your situation. I mean, I certainly am not endorsing Sci-Hub in any way. But I can understand the frustration that people feel when they need to access information and they can't. I can remember, you know, last year I was working in Uganda. I was working with people in the Ministry of Health. Some of the work we were doing, they wanted to access a particular paper which had recently been published, on a new vaccine in cholera. We couldn't access it. I was out of the office, so I couldn't use my office subscription. They were people within the Ministry of Health, so they didn't have access to things like Hinari, these big global access initiatives. And I said to them, so what do you do when you hit this situation when you can't read? And they said, well, we don't do anything. We move on. We don't read it. And that, to me, that's the crying shame of this whole thing, is that they just work with what they can access. And so that, you know, is obviously exposing them to making decisions which may not be fully evidence-based. And I think that's an absolute travesty. So if in those situations somebody felt that they had to use somewhere like Sci-Hub in order to get access to that kind of information, I can certainly understand where they're coming from. In the bigger picture, this isn't really a sustainable model. So we do need to think about how we fund science. And right from the very, very beginning, when I was talking about open access, the first thing we always said is the publication and the dissemination of your research findings is a research cost. It's the same as paying for your reagents, as paying for your microscope, you know, whatever. It's a research cost. In fact, it's the most important research cost. Having had a clinical trial of, I don't know, 40 million, and then to take your research and put it behind a paywall, you may as well have put it in a desk and forgotten it altogether, right? So, you know, to me, this has never made any sense. You know, we need to factor in the cost of publication as clearly as possible. One of the places, if people are interested in accessing free to read material, then they should look for something that's called Europe PubMed Central. That was established, we established that in the Wellcome Trust back in 2006. It doesn't give you access to everything because it only republishes those papers which are already open access, but it does it in an extremely nice way, user-friendly way. That's a free to access resource. There is one, it is a mirror of the site in America, which is called PubMed Central. So you'll find the same papers. I would say Europe PubMed Central is it's got some more user features, so you can create some nicer search facilities. You can make your own little library, particularly if you are a patient group or looking up a particular condition. It's a very nice way of creating a body of papers which you can then look at and use and reuse. So I would strongly recommend that people to use that as a first thing. But as Graham said, it's a very rare researcher who would receive an email to read their paper who wouldn't send it to you. It's just how much time you have to email everybody and get a copy.
So that sounds quite similar to what we at My Science Work do, because we've been from the get-go, we've been advocating and practicing open science and, you know, the unrestricted diffusion of knowledge. And we encourage always the researchers and our users to make you know, the publications open access. So it's an ongoing process at My Science Work, and it's something that we've been advocating for quite a while. So perhaps a final question before we close up. And again, I apologize, we are not able to answer all these questions that are coming in. Perhaps we could, you know, eventually do another series in the future. One final question for you, Robert. What is the level of collaboration between Western institutions and institutions in Africa concerning the sharing of data? What are some of the success collaborations made so far? So this is Samuel from the University of Science and Technology, Kumsai, Ghana, asking you this.
Yeah, no, it's a really important question. And I don't think I can give a comprehensive answer because, you know, the science environment is huge. I mean, it's massive, and there are clearly lots of collaborations that are going on. So therefore, I can only really answer from my own perspective. So work that I did when I was at Wellcome, and then I've continued to do when I was in WHO and now TDR, we're very conscious that there is this inequity between researchers who, if you're researching a tropical disease but are based in Harvard, and the countries where you may well find that. So there are lots of ways that we're trying to work to support capacity both for the researchers. As I said at the beginning, a lot of the researchers that TDR has trained have now been shifted onto the COVID response. I think with regard to Ebola data, one of the elements that we've put into accessing the Ebola data platform is that access has to demonstrate that it's building capacity within researchers who are based either within Sierra Leone, Liberia, or Guinea, where the data came from. These are small steps, but they're really important to build greater equity in data sharing, so that people in low-income, low-resource countries aren't just exporting their data. You know, they may well collect it, and then it gets exported and analyzed, and the credit and the kudos goes elsewhere. So I think we always need to think about, yes, the FAIR principles of findable, accessible, interoperable, reusable, but I would also always bring in what I call the 3 E's. We need data sharing to be ethical, equitable, and efficient, and the equity has to remain front and center as we go forward.
Wonderful. Thank you very much, Robert, and thank you very much, Graham. I want to thank all of you joining us today. We hope you've enjoyed it. We hope this has been useful and insightful. On behalf of attendees and My Science Work, I want to thank Robert Terry and Graham Steele for joining us and for the very important work that you do. And that is a wrap on the formal portion of our webinar. Thank you for joining, and stay safe, all of you.
Thank you, Sally. Thank you, Graham. Cheers.
Pleasure.